You start noticing your hair thinning. Naturally, you start looking for solutions online. And very quickly, you come across something called as PRP. So you look it up. You see before and after results and they look convincing. Then you go a step further and now you see the pricing. 3,000 rupees, 8,000 rupees, 15,000 rupees per session. And just when you think you are getting closer to a decision, it gets more confusing. PRP, PRF, GFC, exosomes, different names, different claims, very little clarity. At some point, you are not even sure what is right for you anymore. So you pause, you delay the decision, and eventually you do nothing. Back to where you started. That kind of decision fatigue, it's more common than you think. I see it every single day in my practice. I have been in this industry for over 10 years and I have seen it deliver excellent results when it's used correctly. And I've also seen it being recommended to patients where it is never going to help. So today, let's simplify this. What is PRP? How is it made? Who does it work for? And the question most people hesitate to ask, do I have to keep doing this forever? Hi, I'm Dr. Vandana Verma, and as your dermatologist, I believe that you deserve to know this. Stay with me. This will save you time, money, and a lot of false hope. So let's start with the basics. PRP or platelet-rich plasma was never even invented for hair loss. It was first used in the 1970s in cardiac surgery and orthopedics where the doctors were trying to improve the wound healing, and they noticed something interesting. When you take the patient's own blood, concentrate the platelets and apply it to the injured tissue, healing improves significantly. These platelets, they rush to the site and release these growth factors like platelet-derived growth factors, vascular endothelial growth factors that trigger the repair of blood vessels, regeneration of skin and underlying tissue. And over a period of time, you heal. Now, if you have ever seen your CBC report, you'll notice three main components: red blood cells, white blood cells and platelets. So the idea behind PRP is actually very simple. If you can separate and concentrate these platelets from the blood and deliver them exactly where healing or growth is needed, you can amplify the body's natural repair process. PRP works for a very specific group of patients, and this is where most of the confusion happens. A lot of people come in thinking that PRP alone will cure their baldness. That's not true. PRP is not a cure. It is a regenerative therapy. It works on the follicles that are still alive. So, the ideal candidate is someone in the early to mid stages of androgenetic alopecia, roughly grade 2 to grade 4, where the follicles are weakened but still active. PRP can only stimulate a weak follicle, but it cannot bring a follicle that is already gone. So, in slightly more advanced stages, grade 4 to 6, PRP can still be used, but it works significantly better in combination with medical therapies like minoxidil, finasteride, and other alternatives. PRP can also be used in telogen effluvium, alopecia areata, post-hair transplant to support the graft survival, and in some cases even during the transplant procedure. Now, where does PRP not work? In advanced baldness like grade 7, where the scalp looks smooth, shiny, which usually indicates the follicles are no longer active. In scarring alopecia, where the follicles are replaced by the scar tissue. Now let's talk about what actually happens during a PRP session. We typically draw blood about 10 to 30 ml, similar to a routine blood test. The blood is then introduced into the PRP tubes and they are placed into a centrifuge which spins at a high speed and separates it into layers. First, red blood cells at the bottom, thin middle layer called the buffy coat which contains platelets and white blood cells, and a platelet-poor plasma at the top. Now this is where technique starts to matter. Depending on the protocol, we may use a single spin or a double spin method to concentrate the platelets. Because for PRP to be actually effective, you need a therapeutic platelet concentration, that is at least 3 to 5 times your baseline. So the normal platelet count is anywhere between 1.5 to 4 lakhs. So let's say you have 2 lakhs in your case, then the platelet concentration will be somewhere around 8 to 10 lakhs in the obtained PRP. But not all systems consistently achieve that, and that is why you see the difference in results. This PRP is then injected into the scalp at the level of the hair follicle using very fine needles, typically spaced about 1 centimeter apart. To make this procedure more comfortable, we apply topical numbing cream and in some cases, we inject local anesthesia for better pain control. The entire session takes about 45 minutes to an hour, and one important thing to understand, this is not about adding something artificial into your body. It is about using your own biology, your own platelets, your own growth factors, and concentrating them in a way that actually makes a clinical difference. Now let's talk about the results, because this is where the expectations need to be clear. PRP is not an instant treatment. You usually require a minimum of 4 to 6 sessions done once a month, and with each session, you may notice gradual improvement of around 10 to 20% over time. In terms of timeline, first 4 to 6 weeks, you may not notice much. Some patients may experience slightly increased shedding initially. Around 2 to 3 months, hair fall can reduce by about 50 to 70%, and by 3 to 6 months, you start seeing improvement in thickness, texture, and density. It may be somewhere around 50 to 60% of overall treatment. With PRP alone, results are usually more limited. However, when you do it in combination therapy, these results can be better than the usual. After the initial sessions, you might need to take maintenance sessions where you will require one session every 3 to 6 months to maintain the results that you have got from the treatment. PRP is generally very well tolerated. Common side effects are mild and temporary. Scalp soreness, redness, mild swelling for 24 to 48 hours. Because it is an autologous procedure where we are using your own blood, the risk of allergic reaction is extremely low. Rare but possible side effects include infection at the injection site, temporary increase in shedding in the first few weeks, which is usually part of the hair cycle shift. Now, the question most people are thinking, do you have to do this forever? The honest answer is not forever, but not once either. You have to continue doing the maintenance sessions every 6 to 12 months. If your hair fall stabilizes and the underlying cause is controlled, then you can space it out further or even stop eventually. So here's what I want you to leave with today. PRP works. The science is real, the results are real, and only when the patient is right, preparation is right, technique is right, and expectations are honest. 10 years in, I still use it. I still believe in it. But I believe in it as a precise tool and an adjunctive therapy, not a blanket answer for every person who walks in with thinning hair. I have linked the patient checklist for PRP consultation in the description below. Use it before your next appointment. Nobody told you this before. Now you know. I'll see you in the next one.